Thank you, Mr. Speaker. In many communities across Alberta, pharmacists are the front door to health care, and yet this government is reducing generic drug fees by 18% to pharmacists, which is already having a negative impact. Pharmacists in Alberta work hard to provide medications to seniors in continuing care centres and lodges. Pharmacists are warning that these changes will prevent them from being able to provide medications to these facilities, leaving the delivery of important drugs to vulnerable seniors at risk. Does the Minister of Health recognize that your plan may result in seniors in care not receiving their medications?
Well, Mr. Speaker, we are very closely in touch with pharmacists across the province ever since I can remember, and certainly very close since we last lowered the price of generic drugs in Alberta. Mr. Speaker, we are the only government in Canada to have provided transition funding for pharmacists, including $15 million for rural and remote pharmacists to support exactly the pharmacists that the honourable member is talking about. Mr. Speaker, it is possible for Albertans to enjoy lower generic drug prices and for us to provide a competitive and prosperous environment for pharmacists across the country.
Thank you, Mr. Speaker. What is the Health Minister's plan to provide medications to seniors in care once the pharmacists are forced out of business by this government's ill-informed actions?
Well, Mr. Speaker, first of all, the honourable member ignores the facts, and I've answered them. I've gone through the facts a couple of times today alone. Mr. Speaker, we provided financial support for pharmacists to transition to the new professional services framework. In fact, Mr. Speaker, since we last reduced generic prices from 45 to 35% of brand name, the number of pharmacists in Alberta has gone up from 1,003 to 1,024. Mr. Speaker, how is this not supporting pharmacists?
Honourable member.
Pharmacies all over this province will close. When will this government trust our dedicated and compassionate frontline pharmacists and get back to the negotiating table to ensure that those in care have safe and stable medication delivery?
Hear, hear. Hear, hear.
Mr. Speaker, this is a little bit beyond the pale. To suggest that somehow seniors across this province are at risk today as a result of changes that have been made in generic drug prices, reduced generic drug prices that the honourable members opposite should be standing up and applauding because it delivers better value for taxpayers is a complete mythology, Mr. Speaker, that I'm sure will only be perpetuated. The fact of the matter is that we're continuing to work with pharmacists. They derive revenue from sources other than dispensing fees. They have the advantage of the new professional services framework. There are other options, Mr. Speaker, and we'll continue to work with pharmacists.
Thank you, Honourable Minister. The member